Hi, Jonathan Wray from Wray Therapy here. I just wanted to make this short video because I've been seeing a lot of people in the clinic recently with pain on the outside of their hip. And there's some really simple strategies that you can use to alleviate your symptoms and take back a little bit of control. Now, pain on the outside of the hip can be there for a number of reasons. Sometimes it's there with other pain, like low back pain. So I would always recommend a really thorough physiotherapy assessment. We've got some great clinical tests that will help identify the source of your symptoms and make treatment much more targeted for you. However, one of the most common reasons for pain on the outside of the hip is irritation of the gluteus medius tendon. Now, gluteus medius is a muscle that sits on the side of the pelvis and attaches into the top of your thigh. And it's really important in controlling the sideways shift of the pelvis on the hip in activities such as running, lunging and stair climbing. Sometimes this gets irritated due to being overloaded, sudden changes in activity, or holding certain positions for long periods of time where its tendon gets compressed against the bony attachment point. The good news is that if gluteus medius is one of the structures that's causing some of your painful symptoms, is that it responds really well to a specific targeted exercise program. Now, some of the things that you can do straight off to avoid some of the irritation and alleviate some of the pain is to avoid patterns or postures and positions where you're compressing the tendon against its bony attachment point. So I'll just try and demonstrate that quickly with a bit of green TheraBand. So gluteus medius sits in this sort of position on the side of the pelvis, attaches here to the bony prominence at the top of the thigh, controls the sideways shift of the pelvis. Any position where your thigh is taken across midline is going to be a compressive pattern for this tendinous attachment and potentially cause you a little bit more pain. So, sitting with your leg crossed, that's a potential for compression. Standing with your legs crossed, potential for compression, or standing with your weight on one leg, there's a potential for compression here. So my top tips to help alleviate some of that irritation is, number one, try and avoid sitting with your legs crossed. Instead, sit with your legs about hip width apart. Number two, try and avoid standing predominantly weighted on one leg or with your legs crossed. Try and stand with your weight more evenly balanced and your feet about hip width apart. And number three, probably one of the biggest ones, is to avoid sleeping on the affected side, because that's going to compress the tendon against its bony attachment and the surface that you're sleeping on. Instead, sleep on the unaffected side and put a really big pillow between your knees to keep your legs in a much better alignment. Now, I've written a much more detailed blog on this. It's on our website, so if you head over to nextwaytherapy.com.au, under blogs, there's one on pain on the outside of the hip and gluteal tendinopathy. If you've got any more questions, feel free to reach out to us on email or give us a call at the clinic. We'll be happy to hear from you. I hope you found this video helpful.